This is Dr. Joseph Baker from the Limerick Chiropractic Center, and I want to welcome you here this evening for our conversation in regards to an anterior pelvic tilt exercise program. That's a mouthful. In fact, many of you out there are wondering, what in the world is an anterior pelvic tilt and why do I have to do exercises for it? Well, listen, we're going to answer a whole bunch of those questions this evening. In fact, for many individuals who are within the Limerick Chiropractic family, listen, you guys are familiar with this terminology. We have talked about it on your x-rays. For many of you who are just signing in and viewing this for the very first time, maybe that's a question that brings about, should you be getting checked? Is this something that I need to be more aware of because of how it unlocks that low back of yours? Now, let me say that again. It unlocks the low back. There's so many people out there. They struggle with low back pain. They struggle with their SI joints locking up on them continually. And they wonder, oh my goodness, do I have to live with this for the rest of my life? Well, let me tell you, I don't know whether you have an anterior pelvic tilt. All I know is that in the evaluation of what you look like on the outside helps us better understand what might be going on the inside. And in the end, the only reason why we would ever recommend doing these exercises, this particular process, is if we have tested the system and we have measured your sacral base angle and we understand that this appearance is present. Let me say that again, that this appearance is present. If it's not measurable and it's just a feeling, you shouldn't be doing these exercises. Don't start doing these exercises if you don't know what your sacral base angle happens to be. If you know, that's great. You should be asking the question, should I be doing these, or when is it okay for me to start doing these exercises? Now listen, when we start talking about this particular anterior pelvic tilt, it's known by a couple different names. It's oftentimes referred to as the butt and gut syndrome. And you're going to see a picture in a minute. And when you see the picture, well, you're going to understand what I mean by butt and gut. Because what ends up happening is that the front of the pelvis, it tilts down. The butt kicks up and back, and at that point, your stomach starts to protrude forward. And some people think, well, you know what? It makes me look like I'm bloated a little bit. All right? So when we look at this, I'm sorry, we'll get to that picture in just a second. When we see this picture, you're going to see exactly that. But one of the biggest things, and I don't want to spend a lot of time on how do you get this, but let's do reality. If you're sitting, if you sit for your job, if you drive in your car long distances, if you're sitting there at night for hours on end in order to sit and watch TV, the likelihood is very high that you're building this situation or this condition inside that low back of yours. Nobody wakes up and says, hey, listen, you know what? I want to point the front of my pelvis down. I want to make sure that my butt kicks backwards. No. And yet so many of us routinely on a daily basis are driving our body towards that particular condition. Now, just to help you understand, when you're sitting, what it oftentimes does is it causes the hamstring muscles to be stretched out. Now, the hamstring muscles are the muscles down the back of your leg. And many of you, when you bend forward to touch your toes, you say, oh, I have no flexibility. As soon as I start bending down, my fingers, they can't go past my knees, and this is not right. I must not be very flexible. No, that's not it all the time. In fact, oftentimes, as we have jobs that require us to sit as we're sitting too much, or sometimes as we're performing different exercises and not keeping our body balanced from front to back, we're overdeveloping the quad muscles. The quads are the big muscles in the front of your leg. And since many of us, since we don't see it, we're not exercising it as much, we don't exercise the hamstring muscles or the muscles in the back of the legs, same with the glutes, the butt muscles, we don't exercise them enough. So with that imbalance, it causes the pelvis, instead of to be in the right position, to tilt too much. Not what we want, all right? And yet, oftentimes, it's a slow and insidious onset. We don't realize that we're building this up day after day, year after year, and slowly we're walking ourselves to where those joints in the low back are just jamming together, and it forces our torso more forward than it's supposed to be. So, all of that is happening at the same time. Now, this picture helps you better understand, and I want you to notice this, all right? This proper posture where the ear is over the shoulders, it's over that which is over the hips where it's supposed to be, and if we travel this down, it's going to be where the ankle is also right over top the center line. But you're going to see, we have this normal low back curvature. The belly is nice and flat, and there's what we would consider a normal leg shape. But when we look at somebody who has an anterior pelvic tilt, and this is why we say your posture is a window into your spine and your nervous system, I want you to notice something. From the bottom up, one of the things that you're going to see is the front of the legs actually look more developed. They're moving more forward. With that, the stomach actually bulges out, and we have an increase in the curvature in our low back. And all of this is because instead of the curve or the angle at the base of the low back being nice and level, now it's pointed way downward. And in turn, it pushes us more forward, and that's why we get this excess or exaggerated curve through the midsection of our body. Now, maybe you look like this. Maybe you have some of those similar characteristics. And maybe you're asking yourself, well, hey, listen, that looks a lot like me. That looks a lot like what I have going on. And my low back is jacked up. It's always tight. It's always uncomfortable. In fact, I can't even bend the tie over, to tie my shoes. I mean, I can't reach past my knees. What's going on here? I'm going to encourage you. Go get checked. Because what I'm going to show you next as far as exercises, yes, they're very basic. Yes, everybody could probably do them. But we have to ask ourselves, are they the most appropriate thing for you? And without getting checked and without having x-rays and without actually analyzing our spine, we're never ever going to know if it's exactly that right thing. Because here's the thing. You're going to notice there is a series or a group of muscles that happen to be involved. And listen, in the end, the wonderful thing about our body is that it's designed to be changed. We don't have to be stuck. And people say, oh, you know what? That doesn't work. Well, let me tell you. Maybe you should talk to some of the orthodontists that are out there. Maybe you should talk to some of those guys that, put kids, day after day into braces or Invisaligns. And let me think. Those teeth can be changed. It's a really simple formula. It's time, it's frequency, it's just simply intensity of work. But we can change this body of ours. Just because we have a certain position that we're in today, we get to change that. In fact, you know that to be in the reverse process also, because many of you have seen grandma getting shorter and shorter with time, where they become more and more hunched over because gravity is constantly pushing down on them. And as they're not maintaining the spine, yes, their body gives into that particular force. We don't want that. In fact, you know what? We're going to talk really briefly about just simply how do you fix that anterior pelvic tilt. But I'm going to say this again. Before doing any of these exercises, you need to ask yourself, do you know where you are? Do I actually have this problem? Not guessing, but measuring, do I have this problem? Because listen, the very first thing in solving this problem, people, you have to move more. The origination of this problem, oftentimes, yes, Some people overdevelop through exercise. And yes, I have athletes who do that. You know what? Those things do happen. But the majority of the people with this particular condition, this anterior pelvic tilt, they happen to sit all day. They are the receptionists. They are those office workers. They are the students who have to drive to campus, sit there on campus, in class for hours on end, sit there all day long reading books, looking through information, studying over and over again, building this into their body. We recognize the first thing is we got to get up and move. In fact, it's not a chiropractic thing, but there are cardiologists who have already done all of the research on the benefits of how it affects your system as far as reducing cardiovascular episodes. Our body was designed to be in motion. When it's not in motion, really bad things happen. Let me think. You have a 30% increase in cardiovascular episodes, in other words, a heart attack, if in fact you have a job that requires you to sit instead of standing up. Do we really need any more detailed information than that? I don't think anybody out there wants to sign up for a greater chance of having a heart attack. And yet, as simple as it sounds, it's got to be purposeful. You got to get up, you got to move. So that's that very first thing. And then we have to lengthen the hip flexors. We have to stretch out the muscles that are responsible for actually bringing the knees up to the chest. That's what those hip flexors do. Yes, they bring the knees up to the chest. So think about all those activities. In fact, when you sit, that's what you're doing. You're bringing the knee up towards the chest as you're assuming that seated position. Well, guess what? Just like when you stand up, you're bringing that knee down, you're moving away from that position, you're stretching, you're lengthening that tissue out. And that's what we want to do. Now listen, one of the wonderful things is most of these exercises, you need no equipment with whatsoever. Can you do split lunges without any exercise equipment? The answer is absolutely yes. If you're not familiar with how to do these exercises, just wait. You're going to have instruction. If you're a patient here at the Limerick Chiropractic Center, yes, we're going to walk you through some of these exercises. We're going to slip and check you to make sure that you're doing them properly. Because just like any other athlete, listen, we want to make sure that you're getting the best outcome possible by doing these things properly. This way you get to move forward in your correction even more quickly. So the very first thing, lunges. We also want to make sure that we're squeezing the glutes. Many of us don't work our butt muscles enough. Yeah, they're really big muscles. There's 3 of them, gluteus maximus, medius, and minimus. Guess what? We have to target them. We've got to work them. It takes a lot of effort in order to actually develop those tissues properly. One of the really simple things is just simply squeezing those butt muscles, contracting them in order to actually activate the tissue. Most people never do that. They don't do the simple things. Why should we talk about lifting hundreds of pounds of weight when you can do something as simple as that in order to help yourself unlock this low back of yours? Now, some of these are probably going to look familiar for you. Something as simple as the bird dog in a yoga pose. Let's look at this. Doesn't look too hard, does it? Done properly, it's absolutely wonderful. Done improperly, well, you're going to create some more problems for yourself. Don't do that. Now, some of you are out there looking at this and you're seeing the picture and you're saying, the heck, are you kidding me? You want one arm and one leg off the ground at the same time? That ain't happening. Here's the wonderful thing. As we start in this process, and listen, there is zero judgment. The biggest thing is you're engaged in the journey and in the process. So maybe it's that point where, hey, listen, you're on all fours. You're just simply you're raising that one hand out at a time. You're holding it there. You're relaxing. You're coming back. You're then going to alternate those arms first. And maybe after a while, you then switch from your arms to your legs. You're going to do that butt kick. You're going to extend that leg out so that you're allowing for that motion to be restored in those hip joints. Now, eventually, as you get really comfortable and you're able to balance on 3 points, maybe at that point you incorporate taking one of those pivoting points away, taking that third point away, and where you're balancing yourself on one hand and one arm in order to activate and stretch out these tissues the way they're supposed to be. Same with these glute bridges. You know what? They don't look overly difficult. You do them, and you do them with a focused intentionality, and they produce the desired change. Oh yeah, by the way, listen, as simple as these things are, let me tell you, if you've never done them, slow and steady wins the race. Slow and steady wins the race. Listen to your body. Too much, too soon is going to be a problem. Give your body the grace that it deserves. You've abused it for all these years. You've used it without maintaining it properly. And listen, it needs time to catch up to the changes that you're asking it to make. So expect that, hey, listen, if you do too much, maybe you're going to get sore and stiff. Understandable. Oh, by the way, if that's happening, don't put heat on it, put ice on it. All right? But that's a conversation for another day. And then when we start talking about working the core abdominal muscle, crunches are a no-go. We don't want to shorten or create more contraction in those hip flexor muscles. We want to create the stability by using planks. And again, some of you may say, are you kidding me? You want me to get down there and do a plank? I'm going to hold that for about 5 seconds, and my arms are going to start to wiggle, and I am going to start sweating like crazy. Pause. Like anything, there are grades, and there's levels, and there are simply small steps that you can take in order to build yourself up from doing a very simple plank to understanding that, yes, you can do this in various forms, in various ways. All right? So, in turn, this isn't a matter of judgment. It's just a matter of being in the process. Now, I love this in that, you know what? We can even take the time when we're having to sit to actually actively engage and position our hips and our pelvis differently. See, normally when we have an anterior pelvic tilt, unfortunately, this pelvis is rotating sort of clockwise like we see here. And what we want to do is we want to actually get our butt and tuck it in, okay? And in turn, bringing our low back, bringing our low back down and around and making it feel like we're winding this thing backwards. Now, this is an awesome visual. And it's one in which you want to practice it standing up, because you're actually going to bring your pelvis in. You're actually going to contract your glute muscles in order to make sure that you're bringing it around and rotating it in the opposite direction of that anterior pelvic tilt. And in doing so, it takes that seated position and makes it less bad. Doesn't make it great, it makes it less bad. Every part of our body describes that we're supposed to be in motion. So guess what? You sitting, it's still not the best choice in the world. We just are going to simply take some of the things that are really bad about it and remove it. Now listen, I gave you a crash course in anterior pelvic tilt exercises. I want to hear from you. What was your takeaway? What was the thing that you learned tonight about your body that you didn't know before? I want you to leave me a comment in the section below. In fact, as always, we ask you guys to do 3 things with these videos. Number 1, like it. Number 2, leave me a comment so I know what you're working on. What was the thing that you're going to start doing? Maybe it's the thing that you're taking away that was an aha moment for you. Maybe for some of you, this has stirred up so many questions, you need to leave me a note of, hey, listen, this would be a great topic for you to talk about on one of your future workshops. But then finally, share this information. each and every one of us out there, we recognize the fact that there's people that we know, they don't know what we know. In fact, we're listening to this recording right now, and we realize, hey, listen, I learned one or two things I didn't know, and I guarantee you there's people in my friends group, my family members, they don't know. Our job is to help our community to become healthier and more vibrant. That's why we pause to share this information. That's why I'm asking you to pause and share this information to help somebody else out. I don't know who that person might be, but what I know is if you're not sharing it, then there's people out there that just simply are missing the opportunity of learning about how to make better choices for themselves. I'm hoping that as you share this information, it's going to be a benefit to somebody in your life. I'm Dr. Joseph Baker from the Limerick Chiropractic Center.